We're doing well. It's been a difficult time. Jackson Heights and Elmhurst are the epicenter of the virus in the United States of America. But, my team is doing well, and we're continuing to offer as many services as we can to the community. And we love our community. So thank you. Thank you for having me on.
Of course. Councilmember Dromm, I have to ask you, the district you represent, District 25th, is filled with immigrants. 68% of both towns is immigrant. A lot of them are South Asian Americans. They're also Indo-Caribbean. A lot of our audience today is watching you on ITV Gold. Could you please address our community and also the kind of issues you've seen them be concerned with lately in these areas particularly?
Sure, I've seen a lot of issues come up and arise, particularly in the South Asian community and the Caribbean community as well. I think first and foremost was the emergency situation that we had at Elmhurst Hospital, where every single room in Elmhurst was taken. People were standing on long lines and very close together, not practicing social distancing, which is the only thing that's going to stop this virus is social distancing. The need to get the word out to our immigrant communities in their own languages, to say, social distancing is extremely important, to inform them of where they can get services, how they can contact my office, etc. We've been working very closely with a number of South Asian-based groups. We've been working with ADICAR, we've been working with the Merchants Association along 74th Street in Jackson Heights, in 73rd Street as well, the Bangladeshi Business Association. We've been working with the South Asian Council on Social Services and a number of other groups as well, trying to, one, get information out to those folks, but also getting services to them. So we're working very closely with the Sherpa Society right now on getting food delivered to them to distribute. So tomorrow, 300 boxes of food, which will contain 5 meals in each box, will be distributed tomorrow to those folks. Now, we have a lot more work to do, but we're trying to work as best as we can with our immigrant communities, who I'm very proud to represent.
Councilmember, you have openly spoken about the racial disparity, which is being very visible in the communities that we're talking about right now. Could you reflect upon what you meant by these racial disparities, and perhaps for our audience to understand the resources that are available for, person in need, undocumented immigrants, or immigrants that come from such low-income families that, they're not able to afford healthcare. Could you please address those racial disparities that you had referred to yourself?
Sure. So as the council member for this district, I have long seen these disparities, but certainly with the onset of COVID, it has been exposed in a way that maybe people didn't notice it before. But those of us who live here do see it. And the disparities are in healthcare, income, housing situations, everything, you name it, you can see those disparities. But for many people in the district, the only way that they can get health care, particularly undocumented, is by going to Elmhurst Hospital. In many ways, Elmhurst Hospital is like a doctor's office to undocumented folks because they cannot afford health care. We see many homes that are overcrowded and illegally converted. So it's not unusual to find a home where you will have 20 or 25 people living in these converted homes under very serious conditions and contributing in many ways to the spread of the virus as well. That's been a big issue for me dealing with the South Asian community in particular. The other one, I think, is the distribution of food and food resources. And, a number of the supermarkets, particularly along Broadway and 74th Street, closed down. One, because I think that many of their workers were getting sick, but also because, of the overall situation where people were afraid to come out. So that's really very, very important. And we're working on that food distribution as well. So these are issues that keep coming up. And I think, though, that this has really shown or made us reflect on what do we mean by essential workers, right? The delivery man who brings your takeout order to your home is essential. I would not have food if it were not for that. The people that are on the front lines at Elmhurst Hospital, mostly all immigrants, they are essential workers. The taxi cab drivers, most of them South Asian in my district, who drive cabs for a living, essential workers. We can't get around like we used to be able to get around. So we need to look at what do we mean by essential workers as we move forward. And we're going to find that those are our immigrant workers.
Definitely. And in terms of Elmhurst Hospital, I have to ask you, since we have you here with us, it's made news nationwide. It is so badly hit. Could you perhaps give us a description of what's happening that you've seen on ground, and perhaps the development over the last few weeks and what you are expecting for this week at least?
Sure. So the situation is bad. Every bed is taken, but they do seem to have a little bit better control over it right now than they did like a week and a half, 2 weeks ago. Elmhurst Hospital was short of PPE equipment, personal protection equipment, such as masks and other types of equipment to prevent them from getting disease, like gowns and things like that. That supply now, I think, is beginning to come in, but here we are, a month into the situation, and they're just getting those supplies. So there's a great need for that. The workers at Elmhurst Hospital are working 12 to 14-hour shifts and sometimes longer. They're so exhausted that they can hardly even get back home and then get back to work again the next day. So we've begun to offer some hospital rooms to them, and that was a struggle for me to get the hospital rooms, not only for the workers that are there, but for those who might go back into overcrowded conditions in the housing where they're living. So there's a provision now where social workers at Elmhurst Hospital will be asking people before they leave the hospital, do you have a place where you can convalesce? Do you have a place where you can socially isolate? Social isolation for many of our folks is not possible. So Elmhurst was dealing with a whole host of issues. The lines outside Elmhurst originally were a block or two long. Now that has calmed down a little bit, and I think we're beginning to get on top of the situation. But it's still very difficult. We've learned of so many deaths. I just heard of the death last week of the president of the Bangladeshi Society, and that was a tragic loss to our community.
And Councilmember, when we're looking at these conditions of the hospital, lack of PPE, and obviously an increase in the number of deaths and the number of cases, what are some of your biggest concerns right now as a council member that's representing this really densely populated district full of immigrants? And, what is the need of the hour right now for you and your team?
Well, prior to COVID, the federal government was looking at cutbacks to the health and hospital situation. Now, our immigrant communities depend on Elmhurst Hospital, and Medicaid cuts would really devastate Elmhurst Hospital. I'm hearing something like in the range of about $40 million in terms of cuts to that. In addition to that, New York State, Governor Cuomo asked, because of he's required to give a response to the federal government, about Medicaid cuts as well. We cannot afford any Medicaid or healthcare cuts to our community. This is the epicenter of the virus. If they take away healthcare, this virus will continue to spread, and it will continue to go out throughout the rest of the United States as well. So what happens here is going to affect what happens elsewhere. That's why we need to take care of our immigrant community here.
And in terms of this communication between the local government and the state government, the federal government, what do you think are still some certain uncertainties in that path? And what do you have to say about your overall, expectation from your governments for the communities that you represent?
Well, Governor Cuomo formed a consortium of 7 different governors in nearby states. And I think that was an attempt to surpass the president in terms of when we can get back to reopening businesses and moving forward beyond the COVID crisis. The president was slow to respond to this crisis. Unfortunately, he has been incompetent every step of the way. You don't know whether to believe him or not to believe him. And that has shaken people's faith in government. Fortunately, Governor Cuomo has stepped up to the plate. He's held daily news conferences, and he's been reassuring to the communities. I think it was a very smart move to build this consortium as well. Mayor de Blasio has been having press conferences every single day, and I have seen him be a steady rock as well. Unfortunately, between all levels of government, sometimes there is tension, but certainly the tension that comes from the federal government and from the Trump administration has caused the most grief and harm to our communities.
Definitely. And in terms of just looking at the apex that we keep on talking about, and the fact that we're reaching the peak of this coronavirus pandemic, your comments on how ready Elmhurst and Jackson Heights truly is as an area, both of the areas, how ready are they right now for that? And what is your personal agenda for the next 2 weeks as we are reaching this peak and then we are looking at flattening of that curve? I would like to know that insight into it. It'd be really great for our audience.
So as we move into the peak, or hopefully the plateau now, but still the peak nevertheless, my goals are really to get food to the immigrant community. I think that's really the biggest need that we have here now. But
Right.
looking forward to the future, I think that the issue is how do we erase some of the disparities that we have seen here, that have become glaring now that we know that our communities lack healthcare, lack housing, those types of issues. So I think we must look forward. Now, New York City's budget, and I'm the chair of the Finance Committee, is looking at a $6 billion hit in revenue. We cannot afford a $6 billion hit. So just today, I got off of a phone conference with Senator Schumer, Senator Gillibrand, and members of the congressional delegation, including Alexandria Ocasio-Cortez, and we asked them to please push for revenue for New York City, because much of what we do in terms of our spending are those social service programs that provide a safety net for immigrants and for the lower income folks who live in a district like mine. So fighting that fight right now to get those federal dollars is my biggest concern as the chair of the Finance Committee.
Council members, since you've spoken about this, in terms of looking at this economic downfall and that the rate of unemployment that we're seeing, your comments on the stimulus package that we are talking about and other benefits that are coming from the federal or state government, how should we be looking at this economy according to you? And how long will it take for us to recover?
Yeah, so one of the original stimulus packages, I'm not sure which one, but it did provide New York City with $1.3 billion in support for COVID-related expenses. Okay, so that will help with face masks, that'll help with gowns, that'll help with hospital expenses, but it did not provide for social service expenses that we're seeing. So as the income goes down, the revenue needs grow, specifically for these social service programs. So we need another package, which Senator Schumer and Senator Gillibrand and the members of the congressional delegation were talking about today, to kind of offset the cuts to the New York City budget. Already the mayor has spoken about cutting the summer youth program. There are going to be other cuts moving forward to other summer programs, what they call the Sonic program, after school programs, and cuts to education, huge cuts to education.
Yes.
We need to make sure that that doesn't happen. And finally, let me say, because I think it's something of major importance to the South Asian community, is we need to support our small businesses. Yes. And not just with loans. Loans is one thing, but with grants. And we need to make sure that they get money so they can be made whole again. The immigrant entrepreneurs in our community are what keeps this community together. And so we need to ensure that they are made whole in the end of this process. It should not be going to big banks and corporations. We need small business help, and we need it now.
And definitely in terms of the education system, and we have so many parents watching this on ITV Gold here with us right now, what should they be looking at in terms of the future of education for the next couple of months, and in terms of all the children that are currently learning from home, that this is the new normal that we have here? Your comments on what are the latest developments in that?
So we're working with the Department of Education to get more iPads and handheld computers into families and into homes. They originally said they were going to need 300,000, but they've only distributed 66,000. So we are really pushing the Department of Education to get those iPads into low-income families who need that. There are many families, particularly immigrant communities, who do not yet have those. So, and those immigrant families are the ones who probably need a lot of extra help to begin with because of the conditions and the poverty that they're dealing with. So that is a big struggle. However, let me also say congratulations to our teachers who are doing a tremendous job adjusting to the changes that they've had to make in terms of how they present information to children. It's not the same as if you were to go to school. I was a New York City public school teacher for 25 years before I got elected to the council. So it's not the same as being in a classroom every day, but considering the crisis that we're in, I think it's really the best that we can do, although every child deserves and needs to have that handheld computer.
You know, Councilmember Dromm, I know that you have lost certain dear individuals to COVID-19, and there are a lot of us that are that either know somebody who's affected or know somebody who has lost a loved one or has lost a loved one. How do we keep the community healthy and okay through this pandemic? And if you could address how you're feeling also, and how we should perhaps take care of the ones that have lost a loved one, I would like for you to address that.
Sure. So about a week and a half or so ago, I lost 5 friends within 2 days, all COVID related. It was, amazing to have to deal with that. This week, I've lost 2 more personal friends. I've also lost more than 24 community folks, leaders in all the different immigrant communities that we have here, and other people who live in Jackson Heights and Elmhurst community, the areas that I represent. It's very difficult. It's very, very difficult. And as I say, it's just too much death and all at once. So, but we are strong, and New York is strong. And when people came to New York City, they knew that our saying is, if I can make it there, I can make it anywhere. And so we're going to make that happen. If we can make it in New York City, we can make it anywhere. And that's my mantra right now. We're going to make it.
How should we as a community contribute back to the council? Are you looking for volunteers? Are you looking for donations of PPE and other, food supplies? I would like to know, the community that's watching this at ITV Go right now, before I let you go here from the interview, how should we, help the council right now?
Sure. So there are a number of social service agencies that are South Asian based, like the South Asian Council for Social Services, like Adhikar, like the Sherpa Society, that could all use funding. So look for one of those types of organizations to make contributions to, because they are distributing food, masks. I had a request for Tylenol, because many people in our community cannot get Tylenol. So those types of things are really very much needed. The other thing that they can do is donate directly to Elmhurst Hospital to their auxiliary fund, because that will help the doctors, the nurses, and other people within Elmhurst, and they need that type of support. Finally, there are some volunteer opportunities for food banks. They're looking for people to come. Of course, they'd have to wear a mask and gloves, but to check out food banks like God's Love We Deliver. That's one organization that provides home delivered meals to anybody who's sick. So check on your neighbor if that's all you can do. Knock on their door or put a note under their door and say, hey, I'm here. If you need anything, let me know. Just simple things like that can make a huge difference in people's lives. It's very difficult to be shut in an apartment with nobody else. I live alone, and I think that's probably the hardest part, is that I don't interact with another human being, during the day. So just a knock on the door, a note under the door, that is a great way to help people too.
Councilmember Dromm, I truly appreciate your time here on ITV Gold. My one last question to you: what do you have to say about all of the medical professionals, the healthcare workers that are truly invested, everything that they have, to helping with COVID-19? I would love for you to end this interview by giving out a message to all of the essential workers that are truly helping both Jackson Heights and Elmhurst.
So our essential workers, our medical workers, our frontline workers are all heroes. They all deserve our praise. It's wonderful to open your window at 7 o'clock at night and you hear the banging of the drums and the yelling and cheering for our frontline workers. And we are so grateful to them for sacrificing, and in some instances, really sacrificing even their family's health, because they leave the hospital, they go home, they have to take off all their clothing outside, go in the house, but it's scary for them. So, because they have their own families also. But we are very, very, very grateful to each and every one of them who've helped our community so much. So thank you to them.